Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Intravenous pyelography. Intravenous pyelography, we can do rapid sequence intravenous pyelogram is done mainly for this is done for renal artery stenosis. Then you can also do CT urography. Okay, in CT urography, this CT urography is mainly used this uses mainly imaging, and also you can put a contrast material. It uses imaging and also contrast material, and by this CT urography we can evaluate or detect the blood in the urine. You can evaluate or detect blood in the urine, kidney or bladder stones, or you can also detect the cancer in the urinary tract can be detected with the help of CT urography. And this CT urography is also performed using we perform this CT urography by using an intravenous pyelogram or a CT scan. Then we have the next, which is cystoscopy. What is cystoscopy? Cystoscopy is actually an endoscopy of the urinary bladder. With the help of the endoscopy, you will visualize the urinary bladder. So here endoscopy of urinary bladder is mainly done via the urethra. And for this you use either a flexible or you can use a rigid cystoscope can be used for this method. So this is the rigid cystoscope. This is the flexible cystoscopes.
thank you and thank you for watching.